Iron deficiency anemia is one of the most common nutritional disorders worldwide. As we'll explore, iron deficiency can stem from multiple causes and has significant impacts on overall health. Iron plays three vital physiological roles in human health. First, as the core component of hemoglobin, it enables oxygen transport in red blood cells. Second, iron is essential for mitochondrial function, supporting cellular energy production through electron transport chains. Finally, iron is irreplaceable for hemoglobin synthesis itself. Without adequate iron, the bone marrow cannot produce functional red blood cells. The body absorbs and processes iron through a tightly regulated sequence. Dietary iron exists in two forms: heme iron, Fe2+, from animal sources, and non-heme iron, Fe3+, from plant-based foods. In the duodenum, ferric reductase converts non-heme iron to the absorbable ferrous form. This iron is then transported across enterocytes by divalent metal transporter 1. Inside cells, iron binds to ferritin for storage or couples with hephaestin for export into circulation. There it attaches to transferrin, the transport protein that delivers iron to target tissues like bone marrow for hemoglobin synthesis. In healthy adults, the body contains approximately 4 to 5 grams of iron, distributed across key systems. The majority, about 1,800 milligrams, is incorporated into red blood cells as hemoglobin, supporting oxygen transport. Another 1,000 milligrams is stored in the liver as ferritin, serving as a reserve. Recycled iron from aged red blood cells accounts for 600 milligrams within reticuloendothelial macrophages, while 300 milligrams supports ongoing hemoglobin production in the bone marrow. Iron deficiency anemia is defined by abnormally low hemoglobin levels in red blood cells, the critical protein that carries oxygen throughout the body. Diagnostic thresholds vary by gender. Hemoglobin levels below 12 grams per deciliter in women or below 13 grams per deciliter in men, representing a significant global health burden affecting approximately 25% of the world's population. Strikingly, half of all anemia cases worldwide, that is 50%, are directly attributable to iron deficiency. These statistics underscore iron deficiency as the leading cause of anemia globally. Certain populations face elevated risks of developing iron deficiency anemia. Women of reproductive age are particularly vulnerable due to monthly blood loss during menstruation, significantly increasing their iron requirements. Vegetarians and vegans may also be at risk unless they consciously incorporate plant-based iron sources and enhancers of iron absorption, as non-heme iron from plants is less bioavailable than heme iron from meat. Infants and children, especially those experiencing growth spurts or born prematurely or with low birth weight, have heightened iron needs to support development. Without adequate supplementation or iron-rich foods, they can quickly deplete their iron stores. Moving now into a focused discussion on iron deficiency anemia. IDA progresses through 3 distinct stages, each marked by specific physiological changes. In the first stage, iron stores become depleted, indicated by low serum ferritin, though hemoglobin levels and red blood cell production remain normal at this point. The second stage occurs when the bone marrow begins producing red blood cells with insufficient hemoglobin, resulting in reduced mean corpuscular hemoglobin, MCH, on lab tests even before anemia becomes apparent. By the third stage, hemoglobin levels drop below normal thresholds, resulting in full iron deficiency anemia with microcytic, hyperchromic red blood cells visible on peripheral smear. Now, let's explore the underlying causes and pathogenesis of how iron deficiency anemia develops in the body. From 3 principal causes, iron deficiency anemia arises. each disrupting iron balance through distinct mechanisms. Insufficient dietary intake, particularly of bioavailable heme iron from meat, fish and poultry. Vegetarians and malnourished individuals are especially vulnerable as plant-based iron has lower absorption rates. Increased physiological demand, most notably during pregnancy, where iron requirements nearly double to support both expanded maternal blood volume and fetal development, often exceeding dietary intake capabilities. Impaired intestinal absorption, seen in conditions like celiac disease, autoimmune gastritis, or post-bariatric surgery, states where duodenal iron transport mechanisms are compromised, regardless of dietary intake. Gastrointestinal disorders contribute significantly to iron deficiency anemia through two primary mechanisms: chronic blood loss and malabsorption. Inflammatory conditions like ulcerative colitis and Crohn's disease cause both intestinal bleeding and impaired iron absorption due to mucosal damage. Colon cancer similarly leads to occult blood loss that may go undetected. Other pathologies, such as intestinal infections and colon polyps, can also produce chronic blood loss, gradually depleting iron stores even before anemia becomes clinically apparent. Characteristic symptoms, all stemming from inadequate oxygen delivery. Fatigue arises as the body struggles to produce sufficient hemoglobin for oxygen transport. Pale skin develops when reduced hemoglobin levels diminish the normal redness of blood circulation. Heart palpitations occur as the cardiovascular system compensates for diminished oxygen capacity. Shortness of breath reflects the muscle's insufficient oxygen supply during exertion. Untreated iron deficiency anemia can lead to serious systemic complications across multiple organ systems. Cardiac complications include tachycardia and arrhythmias as the heart strains to compensate for reduced oxygen delivery, potentially leading to heart failure in severe cases. In pregnancy, severe anemia increases risks of preterm delivery by twofold and doubles the likelihood of low birth weight infants due to placental insufficiency. For children, chronic deficiency impairs growth velocity and cognitive development, with potential long-term neurodevelopmental consequences. Diagnosing iron deficiency anemia requires a systematic laboratory approach combining multiple tests. The Complete Blood Count, CBC, provides initial screening revealing microcytic hypochromic anemia through low hemoglobin and hematocrit values with reduced MCV and MCH. Serum ferritin serves as the most sensitive indicator of depleted iron stores, with levels below 30 nanograms per ml, confirming deficiency. Comprehensive iron studies evaluate transferrin saturation and total iron binding capacity, TIBC, while excluding other anemia types. Folate levels assessment helps differentiate mixed nutritional deficiencies, as folate is crucial for proper erythropoiesis. Management employs targeted interventions based on severity and underlying cause. Intravenous iron rapidly replenishes stores, often requiring just 1 to 2 infusions for moderate cases, particularly when oral absorption is impaired. Oral iron supplements remain first line for most patients, though 3 to 6 months of therapy are typically needed to fully restore iron reserves and hemoglobin levels. In severe symptomatic cases, blood transfusions provide immediate red cell mass improvement, while medications like erythropoiesis-stimulating agents may be adjunctively used to boost marrow production when inflammation complicates recovery. Preventing iron deficiency anemia involves a multifaceted dietary approach. Iron-rich foods form the foundation, including both heme iron sources like lean red meat and salmon, and non-heme options such as beans, dried fruits, and iron-fortified cereals. Vitamin C co-consumption significantly enhances non-heme iron absorption. Pairing iron-fortified bread with orange juice or adding strawberries to oatmeal can boost uptake by 2 to 3-fold. For toddlers, introducing iron-dense solid foods like pureed meats and fortified cereals is critical during rapid growth phases to prevent developmental delays. This concludes our presentation on iron deficiency anemia. We've explored its causes, symptoms, diagnostic approaches, and management strategies.